Hello and welcome to Round Robin. I'm your host, Robin McCormick, with the City of Hampton's Communications and Marketing Department. And today we're going to give you a little bit of information about healthcare and the new system and some tips you might need if you're getting enrolled, or particularly if you're related to a young person who maybe needs a little tips. My guest is Gaylene Kanoyton. Welcome.
Thank you for having me today.
So Gaylene, you actually started a company, Celebrate Healthcare. Why did you do that?
Because I woke up last year in July, the beginning of July this last year, and I said, the Affordable Care is going to start in October, and I'm not hearing anything that's happening on the ground. And so I started talking to some leaders in the city, and I started talking to some other organizations, and decided to start Celebrate Healthcare.
Well, and you know, I think people needed help to begin with because
Yes.
navigating an online system is confusing for people.
Mm-hmm.
The rules are all new, but then when there was troubles with the rollout, you know, you were having these big healthcare fairs, and people were coming in for a lot of assistance. I mean, you really filled a need.
Yeah, we had an opportunity to educate over 5,000 people, and we enrolled over 1,500 people from even from Northern Virginia down to Hampton Roads, and the vast majority were in Hampton Roads that we had these events. It's a one-stop shop. It's where someone can come in, they can learn, they'll have seminars where they can learn about the Affordable Care Plan. We partner with the Urban League so they can learn about how to have financial wellness, how to purchase a home, balance your budget, the whole 9 yards, how to fit healthcare in your budget. And then we also have a workforce development piece, because the more people that get in healthcare, the more jobs is going to be available. But if these people aren't trained to take these jobs, then they won't be filled. And we don't want them outsourced. We want to keep them in the United States, and we want to keep them in Hampton Roads.
And then I also noticed, at least when I was there were people from the city, from Youth Education and Families, from Social Services, talking about other services related to health and healthiness that are available to people.
We want a person to be able to come in, a family or a individual to come in, and they be able to get all the resources they need, you know, to live. And so not only if they find out about the Affordable Care, they also can talk to the Department of Social Services, because in some cases they might be denied a subsidy because of their income. Because we don't have Medicaid expansion. But they can go to the Department of Social Services and they can find out some other services that are available. And if they're a family, they can find out about CHIP and you know, and other services. And you got also the Child and Wellness, the Family Services. They can also provide services as well.
So even though you're a company, you pull in a lot of nonprofits and community resources to all work together to really answer people's questions.
That's right.
And connect them with what they need.
And that's why we call it the Celebrate Healthcare Enroll Fest, because we want it to be a festival. We want it to be informative. We want it to be fun. People can bring their children, and we'll have activities for them. Most of our events will have it for them. Even when we went through some challenging times with the website, people were still coming in because they wanted to know what healthcare can do for them and what was available to them.
And I think especially for people who are not comfortable on the internet, the sign-up process can be a little confusing. I know they have other options, but sometimes some people just feel more comfortable looking somebody in the eyes and asking the questions.
Well, you know, this is a big thing, you know, and when you've never had insurance before, or even people with insurance, some of them still don't quite understand the process. So to have someone there one-on-one, we have certified application counselors is there. We do deal with a broker, TFA Benefits that is there as well, who's been with us since day one, and they actually, you know, go through and explain what a deductible is, you know, what your insurance coverage is and everything, and all of that is included. So we have a wealth of people that are there that can walk people through the process of being enrolled into healthcare.
So what are people's big questions? If we can give folks out there, you know, maybe 5 answers to things that might be in their heads, or that you know, people commonly ask, what are they?
Well, first, what is it going to cost me?
That's a complicated thing. You can't answer that like that.
I can't answer it just like that.
Yeah.
You know, there's certain tiers, you know, and then you need to decide what tier is going to work for you.
Okay.
You know, for example, if you have a pre-existing condition, A bronze plan may not be good for you.
Okay, so let's just start there. So there's levels of coverage that they call bronze, silver, and gold?
Yeah.
Is there also platinum or 3?
Yeah, bronze, silver, and then there's gold. Yeah, there's several different levels that you have on there.
And so bronze means it's less payment per month, but it doesn't have as high a coverage, or it has a higher amount that you have to kick in when you go to the doctor or hospital.
Correct. So some of the plans that you might have, some of the plans you have that you might pay a lower deductible, and then you might have to, you pay a lower fee, but your deductible might be higher.
Right.
It depends on what works for you.
Right, so if let's say I'll go over 26, because some of those kids are covered on their parents' insurance now. So if you're 27, you're healthy, you maybe, get some sort of infection, go to the doctor once a year, do your well care checkups, you might opt for that lower plan for now.
For a bronze. And silver plans are very good too. So bronze and silver. Silver plans are good as well too. You have, but it goes back to what you actually need.
Right, but if you know that you have diabetes or high blood pressure or some complicated things where you see multiple doctors, where you're on prescriptions, those kinds of things, then you might choose to opt for
a higher
different
plan.
level. Okay.
And then we have 3 providers that are in the system. So you have Aetna, you have Blue Cross Blue Shield, and you have Optimum. Those are the 3 providers that are in Hampton Roads that you can choose from those providers.
So you look at the level of coverage you want, and then you look at what each individual provider offers in terms of, it is complicated, isn't it?
Yeah, and then depending on what your income will determine what your subsidy be if you qualify for a subsidy too.
Right.
I've seen premiums be as low as, which is your monthly payment, be as low as $9 a month. I've even seen,
after the subsidy.
Yes.
Yeah.
I've even seen $0 a month. Somebody didn't pay anything, but I've seen them as high as $300 a month or $350 a month. But on the other side of it, I've seen people that were paying $1,200 a month, and then when they roll into the affordable care, they drop down to $300 or $400 a month, and so therefore that's a big, huge savings for them.
Right. So some of these folks, there's the uninsured who are now eligible, but there are people who were buying their insurance on the open market because they're self-employed or retired early and aren't old enough. So there's a variety of people who are looking into this.
You have a little bit for everyone. You have different questions from people who've never had insurance before. And so they're walking in and they've never had insurance, or people who've been without insurance for 10 years, or 5 years. They've been out without a job, or they just got a job, because you have to make a certain amount of money to enroll into the affordable care.
Right.
Because of, our situation that we have right now. But you can still get insurance if you don't qualify for a subsidy. It's just that you won't get the subsidy, which is the discount. However, in all insurance plans, all of them, whether you pay full rate or whether you get the subsidy, you still get your free women's wellness exams, mammograms, your physicals, everything that qualifies under the affordable care that you can get.
Has to be in that policy.
All the plans, correct.
So the big question people have, how much does it cost, takes you a really long time to answer.
You need to sit down.
Because there's so many variables.
Correct.
Okay. What are the other big questions?
So the other questions is, they ask, will my doctor accept my insurance? That's another question. They'll say, some of my doctors, well, you need to ask your doctor what insurance do they take. That's a question. If you want to keep your existing doctor, you ask what insurance you take. So
maybe before they even come to an Enroll Fest, or before they go online, if they're going to do it themselves, that is a smart thing to do, is check with your doctors. Because a lot of it's online, but it's really easier if you call the doctor's office and say, what insurance plans do you accept?
Yeah, what insurance plans do you take, or whatever. So you need to know that as well, too. And then I think the most thing is it going away? Everyone asks, is it going away? Healthcare is the law. It's the law of the land. So, healthcare is going to be here to stay. So, people, the more you can learn about it, and the more you educate yourself and educate others about it, the better off we'll be. We've enrolled over in Virginia, somewhere around 200,000, which is well over what we expected. Close to 8 to 10 million in the United States. So, people are, interested, and we still get calls. I get calls every day on a healthcare question.
Really?
Every day. And people are ready to enroll on November 15th.
So that's the next open period.
Yes.
But you said there are some times that people can enroll that's not at that deadline.
That's correct. So you have when you can enroll outside of the enrollment period. So that's a life-changing moment. So if you have insurance in your job or company, you have life-changing moments. It's the same thing in the affordable care. So if you were to get married, have a baby, or if you're a victim of domestic violence,
really,
you can get help. You can enroll into the affordable care plan. If you're a foster care parent or a grandparent, you can, and you age out, and your child ages out. If the child ages out of the system, then they're able to enroll into the affordable care. So there's a list. You can go on healthcare.gov, or you can call 1-800, which is 318-2596, and they can explain to you all of these different factors as well.
Well, now let me ask you a question. Isn't there also the option for dental care under this?
You can get it. Dental care is still being worked into the affordable care. It's not quite there yet, but you can opt to get dental care, and there are certain plans that you can get that's going to fit within your budget. I've seen families of 3 that's got insurance, and their health insurance and dental insurance, and pay only $120 a month for both.
I've seen so many people that will go to the doctor when they have a problem, don't go to the dentist, and let those problems really, really pile up.
Well, we do coverage from coverage to care plans now. And with the coverage to care plans, what we do is now, before the enrollment period, we teach people who already have health care the importance of understanding your bill, what a deductible is, what your premium is, what your insurance is covered, how to choose a doctor. Also, the importance of your dental care is one of them. I'm actually going to bring in. There's the Colgate has a big dental bus, and we're going to actually bring them to Hampton Roads because dental care is very important. So we kind of raise that issue and try to educate the community on dental care as well as other health care. Bonzacor, Centera Health System, and Healthcare, and Riverside Health System, they're all partners, to celebrate health care. And so we get a chance to partner with them, GenCare. And so we have multitudes of other companies that support, our Celebrate Healthcare and Roll Fest.
But it really is a life-changing thing for some people. I think the folks who don't have insurance now, some of them go to the emergency room when there's a problem because that emergency room has to treat them. And so if they're enrolled then, and if they have coverage, they have to learn to use the preventive system and to go through a regular doctor care to maybe eliminate and reduce those critical visits.
We want to teach people that to no longer use your emergency care centers as your primary doctor, and that's what it is. People, they get sick and they go to the emergency care, and they go to the emergency hospital immediately. We don't want that anymore. We want preventative care. The more people that we get to get physicals every year, they can find out if something is wrong with them ahead of time.
That's right.
On the front end, it's going to save us on the back end.
Prevention versus treatment.
It's going to save us on the back end.
Okay. Well, thank you, Gaylene, and we'll let people know when the next seminar is, and make sure they can attend.
All
thank
right.
you very
much. Thank you so much. Great.
Thank you for watching, and I hope you've learned a little bit about the healthcare system and where to get answers to your questions. Thanks for watching.